Welcome to The Simple Show. Today's topic, dementia and how we can naturally treat and prevent dementia, here in discussion with Dr. Heinz Luescher in his practice. So let's start off. Let's say I'm 40 years old, and what can I do to prevent dementia?
Try to eat more veggies, more fruit, more salads, and not just fries and donuts. That's the answer.
That's it.
And then, well, of course, there is more. See,
okay.
Just watch.
I thought you were finished.
Physical exercises are important, and watch out for your psyche. You see, your mental health is important as well. And you shouldn't have too much of a high pressure. This is also bad. And
blood pressure.
And blood pressure, and or diabetes and diseases like that. Of course, are supporting the development of dementia.
Okay, so you know, where do micronutrients also fit into the game, and which ones are vital or very important in perspective of prevention?
Like always, I have always to explain that the energy is produced in the mitochondria, and they need all the micronutrients. Otherwise, the energy the cell cannot produce it properly or enough. See, part of it always, of course, but we need 100% of energy in the brain cells. And in the age of 40, as I said, proper nutrition is the basic. I suggest to add omega-3 fatty acids. So it depends where you're living. So if you eat salmon twice a week, then you're fine. But if you don't eat fish at all, then I really suggest to support your health with omega-3 fatty acids.
And is that DHA or EPA? Which one would be more important here? Or does it not matter?
Yeah, it does. So DHA is very important to support the health of the brain cells. See, we need omega-3 in the walls of the cells.
Okay. So omega-3. What else? What else would you say is vital?
Basically, everybody is lacking vitamin D. This is very controversial. Allopathic medicine says 1,000 units a day is okay, and I personally take 5,000 in the winter and 3,000 in the summer. Younger people need less, and kids and young teenagers don't need anything in the summer. But at the age of 40, I would suggest 2,000 to 3,000 every day, even in the summer.
Okay.
So that's units, international units. So omega-3, vitamin D, this is basic. Everybody should take that. And to prevent dementia in this age, I suggest a polyvitamin product where all the vitamins, minerals, and the trace elements are in.
Let's fast forward 25 years. So now I'm 65 and I'm beginning to forget simple things that, are now perceived as symptoms for dementia. So I'm here, dementia around the corner. What can I do now?
Well, now it's very important to really take care. See, this is the treatment of dementia is somehow easy. I know everything you need to swallow, but it's several things. And my experience is that people tell me, oh no, I can't take 7 different pills, that's too much. But we need all of them. If your dementia is really coming and you feel it, you forget a lot, then I cannot help you if you only take 2 or 3. So besides the omega-3 and vitamin D, we need coenzyme Q10, ubiquinol, at least 100 milligrams, better more, 200 or 300. And we need NADH. Both products are increasing the energy in the entire body, but especially in the brain cells. Then what I also suggest is antioxidants. This is vitamin C and grapeseed extract, green tea extract, whatever, flavonoids and so on. These are helpful because there is an inflammation, a silent inflammation is going on in such a brain, and we can decrease this inflammation with antioxidants. And very important is coconut fat. Coconut is, well, I have to explain. See, normally the brain produces energy from glucose, or sugar or carbohydrates. But to produce energy, we need insulin and several enzymes. And insulin from the pancreas is not going through the blood-brain barrier. So the brain itself produces insulin. And this comes to an end after years of inflammation. So there is no more insulin in the brain. That means sugar, glucose cannot be burned by the brain cells. And so they die. They have no energy. And when you take coconut, there are fatty acids in there the brain cells can use. It's really, really amazing. Okay. Something simple like that can improve dementia.
So when I'm 65, are there any cross issues? So if I'm taking a whole bunch of other medicine or medication, and I start taking, supplements, Q10, NADH, all these, is that a problem?
No. See, that's generally in nature. There are no interactions. Huh? You can eat, let's say, a soup. You have carrots, you have potatoes, you have cabbage, you have celery. You can do anything in it, and it works together. See? This is creation. See, that's perfect.
And my last question, it goes back to prevention. Burnout is often linked to depression, and depression, I hear, is often linked to dementia. So, is preventing a burnout also one of the big things, back to me being 40, that I have to make sure to take care of?
Look, personally, I believe that a burnout has nothing to do with a depression. Burnout is a physical breakdown. Huh? It's the adrenal gland that doesn't work anymore after years of stress. But then, when you are willing to work and give your best, see, and you can't anymore, you often leads into a depression. You're frustrated because you cannot work, and that's when then the patients get antidepressant medication. I never give that. I always build the body up. So for me, burnout is not a reason to be dement later on. Okay. But real severe depressions, they support dementia.
That's the link, obviously, from burnout, a link to depression, and then depression that just degenerates your nerve cells, I'm guessing. Yeah, because you're in a lower state of metabolism, in depression. All right, thank you very much. So that was a simple show, and we're going to dive one little step deeper into treatment of second stage dementia. That's going to be in the next video, so see you soon.